Good afternoon, everyone, and welcome back to another episode of Let's Talk Health. Today, we have with us Senior Consultant Medical Oncology, Dr. Brigadier A.K. Dhar, who is an eminent practitioner and holds special interest in immunotherapy. The topic that Sir has chosen today is immunotherapy in lung cancer. Sir, welcome to our show.
Thank you, Dr. Supriya.
Sir, to begin with today's episode, sir, we have heard that lung cancer is a deadly condition that affects masses. So, can you help us with the incidence of lung cancer globally as well as in India?
See, lung cancer is one of the commonest cancer, not only in India but across the world also. The incidence of lung cancer has been rising steadily and slowly all over the world. If you ask me the statistics, approximately 2.2 million new cases of lung cancer are detected annually across the globe, and 1.8 million of patients of lung cancer, they die annually. As far as India is concerned, the lung cancer incidence has been increasing, particularly in urban population, and it has been found that annual detection of lung cancer in Indian population is around 70 to 80,000 people who are newly detected with lung cancer.
So, it's a known fact that it affects middle-aged and elderly people. So, are there any specific risk factors associated with lung cancer?
See, it affects middle-aged and elderly people, but over a period of time it has been seen that the young people are also not, they are also affected from lung cancer, they are not spared by lung cancer. Like in American Oncology Institute, Gurugram, and I have worked in Imphal also, I have seen a lot of young patients coming in stage 3, stage 4 disease. But yes, it's a disease of middle-aged and elderly people, and the risk factors responsible are mainly smoking, consumption of any kind of tobacco, then use of arsenic. In fact, the places where arsenic level in the water is high, these people, they suffer from lung cancer. And radon gas, it's a very, very important thing to understand and know about radon gas. It is responsible for lung cancer. How radon gas affects and causes lung cancer, I'll be telling you in the subsequent talks. Then ingestion of alcohol. Alcohol is also one of the factors. Then lifestyle changes, lack of exercise, all these factors, they pool up and they initiate the process of lung cancer in an individual.
So, sir, out of the factors that you pointed out, smoking is the one that the general population has heard the most of. So, are there any kinds of smoke or the types of smoke that causes lung cancer?
One is smoke, of which is basically by inhaled tobacco. Second is the tobacco consumption itself. Third is the smoke of the atmosphere. Fourth is the industrial smoke, which contains particularly in industry which deals with asbestos and heavy metals. So these are the various kinds of smoking factors which are responsible for causing lung cancer.
So one smoke that we've heard of, passive smoking.
Yes.
So what is passive smoking?
See, passive smoking is one of the deadliest form of smoking, or one of the factor which is responsible for causing not only cancer, various kinds of diseases. And this entity has been brought into limelight recently. Passive smoking is that a person smoking inside the house in presence of the family members, and these family members can be his wife, can be the children, can be the infants, or it can be the toddlers. So it affects all these people and they become used to smoking. And it has been seen that not only they get the diseases like bronchial asthma, subsequently cancer, cardiovascular diseases, but subsequently when they grow up, these children, when they become adults, they are more likely to pick up the habit of smoking. So this is why passive smoking is a very important topic and everybody should understand it.
Absolutely, sir. So, sir, with the increasing incidence of lung cancer, are there any new advancements on what are the general treatment of lung cancer?
See, basically, if you take the treatment of cancer, there are broadly speaking three kinds of treatments. One is surgery, second is systemic therapy, that is chemotherapy, targeted therapy, immunotherapy, various kinds of therapy, systemic therapy, and third is the radiation therapy. But we have seen over the past few years that there has been tremendous improvement, tremendous research as far as the systemic treatment of cancer is concerned, which I will be talking in the subsequent discussions.
So, sir, immunotherapy, the topic that you've chosen is immunotherapy. I suppose it's part of chemotherapy or the systemic therapy that you just discussed. What exactly is immunotherapy for the layman?
One way you are right that it is a kind of a chemotherapy because it's a systemic therapy. But if you see scientifically, immunotherapy is entirely different from chemotherapy. In the sense that for my audience, I am talking because they should understand it, that chemotherapy kills the cells. And when they kill the cancer cells, both healthy and cancer cells are killed. But immunotherapy, what it does is, it only affects the abnormal cells on the surface of a cell, which are cancers, and attacks these abnormal proteins, which are responsible for producing cancer. So the cell is saved and the protein is killed or destroyed. So there is no harm to the patient body. Only the protein which is responsible for production of cancer, that is destroyed and the patient gets gradually all right. It's not that simple. For the sake of understanding, I am telling you, so the people should understand why immunotherapy is superior to chemotherapy, number one. Why it is more effective than chemotherapy, number two, and why there are no or minimum side effects of immunotherapy as compared to chemotherapy.
So, sir, that was immunotherapy put in very simple words and very informative. Are there any different types of immunotherapy?
Oh yes, there are various kinds of immunotherapy. Now, broadly speaking, I'll tell for the sake of my audience understanding, there are various kinds which affect various receptors. In body, there are thousands of receptors available. And if one of that receptor gets abnormal, it produces cancer. Like there is a receptor PD1. Now, immunotherapy, if the cancer is being produced by PD1 receptor, there is a separate immunotherapy for that. And that is called pembrolizumab. Then there is a PD-L1. The receptor is different. So, immunotherapy is also different. So, that immunotherapy is nivolumab and atezolizumab. Similarly, there is a CATL14. This is very complex science, but only I want to tell my audience, and for the sake of my understanding also, that you have to identify the receptor. You identify the receptor and hit that receptor. The rest of the body is safe. So this is what various kinds of immunotherapy. That's why whenever patient comes to us, Sometimes people may say, you are delaying the treatment, you are asking for the costly investigations, but the effect is the people who understands the result of these receptors, because the immunotherapy is different for the same disease. That is what is precision oncology. Precision oncology is that one food size does not fit all.
Right, sir. Right.
So that is what is immunotherapy, different types.
Sir, I was reading in some article, there was reference of monoclonal antibodies. What are, sir, and is there any significance of these in lung
Yeah.
cancer?
See, in a very, very simple terminology, I will say that these tumor cells which produce cancer in the body, they have got different antigens on their surface. So what we do is we produce antibody against them. And when the antibody from outside goes inside the body, there is a fight between antigen and antibody. And we have got such a forceful antibody, such a fierceful antibody like patent tanks, that these antibodies, they kill antigen. And when the antigen is killed, tumor cell is also killed and the patient starts responding. So this is what is monoclonal antibody, which is also called targeted therapy. Targeted therapy means you target a particular thing, particular substance.
So, sir, what are the different kinds of these monoclonal antibodies?
These are, yes, in American Oncology Institute, across India, all the centers and wherever international centers are there, we got like bevacizumab, trastuzumab, we got rituximab. These are all targeted therapy. They are different from chemotherapy. Okay. They do not have that kind of side effects. They are safe.
Yes, sir. So, you said it's different from chemotherapy, but that is on the internal level. Externally, sir, the administration or the treatment plan or the side effects, whatever, are those also different?
It is like intravenous infusion. You just dissolve in glucose or normal saline and give intravenously. They hardly take half an hour, 1 hour, which is simpler than administration of chemotherapy. Patient comes for 1 hour in the daycare, takes it and goes back home safely. Very safe.
Okay, sir. So the duration is usually shorter.
Shorter, and the side effects are also lesser.
Okay, sir.
And potency, efficacy is more.
So it's any day better than...
Yes, yes.
Can this be given in combination with chemotherapy?
Oh yes, it is usually combined with chemotherapy to enhance the effect of chemotherapy.
Okay, sir. So for me, personally, it was informative, very informative. If you have any message for the audience?
Yeah, my message to the audience is that don't be scared of any kind of cancer. Let me say that about 70 to 80% cancers have become treatable. We can cure it. American Oncology Institute has got all the varieties of treatment available. Your job is, the patient's job is just to knock at our door. Inform us and we are ready to help you, to treat you. That's all. Thank you very much.
Thank you so much, sir. Thank you so much. And thank you all for joining in. We'll meet again in the next episode. Thank you.